Family member, friend, coworker, or even yourself that suffers asthma. Even some of us may be at risk of having asthma and we just don't know it yet. I myself had asthma, and you would not believe how bad it can get. It feels like a fish out of water. As being asthmatic, we are vulnerable to cold air, pollen, and dust according to difficult to treat asthma. Asthma is a heterogeneous disease caused by gene by environment, meaning we can get it by an early age if individuals have family history of it. In 2015, asthma was the most common chronic respiratory disorder with an estimated prevalence of 358 million cases. And asthma has increased in the past 50 years. Today, I'll be talking about different points of asthma and how it can affect one life, but yet of dealing with the disease. The symptoms of having asthma is wheezing, coughing, and difficult breathing. Also, tightness in the chest. These symptoms can be triggered from smoke, cigarettes, gas, and a simple candle. It can be triggered by cold air, which can make your chest feeling tight. I would recommend not to plan a trip to Boston. Dust is also one of the triggers. Cleaning can stir up the dust particles, making them easier to inhale. Now we identify these symptoms, we can take action. One inhaler is steroids inhalers, which can be ProAir HFA that relaxes the muscles in the airway and increases airflow to the lungs. Used to prevent and treat wheezing, also shortness of breath. Another is Ventolin, which is the same thing as ProAir except Ventolin does not contain steroids, and it is in a blue container. Unlike ProAir, it is in a red. The side effect of these inhalers may cause dizziness, spinning sensation, lightheadedness, sleep problems, tremor, nervousness, sweating, nausea, vomiting, diarrhea, dry mouth, and throat muscles cramp. Also, an unusual taste in your mouth. I know it's a lot. Everyone is everyone is different having asthma. Some have mild, others have severe. Many cases of asthma fall between the two ends. Those who have symptoms of asthma more than 2 days per week, but not daily may have mild persistent asthma. And if you are asthmatic, you can still play sports. David Beckham, a very well-known athlete, suffers from a mild form of asthma since childhood. Another one is Jackie Joyner Kersee, a basketball player and track athlete, also performed in the Olympics, who played in those sports in UCLA as well. She has severe asthma, but has it under control. Maintaining asthma is to know what's triggering it and try to avoid the triggers. Take medication and prescribed by your doctor, and make sure you are taking them properly. If you are a smoker, quit the bad habit. If not, avoid all secondhand smoking. Exercising can help build up your lung muscles, boosting your immune system, and being healthy. Having asthma is a variable. It can get worse or it can get better, just depending on your symptoms. There is also a preventer inhaler, which of course prevents inflammation and sensitivity in your airways over time. That inhaler is called QVAR. The side effect of this inhaler is dry sore throat, hoarseness, a bad taste in the mouth, headache, or voice changes may occur. Asthma can go away. It just happens more often in childhood than when it starts in adulthood. No studies had described sudden unexpected death in a nationwide setting and in patients with uncontrolled asthma. But more than 3,500 people die of asthma each year. Nearly most patients are over 65 or older years. Recent study shows that half people with asthma have at least one asthma that attack children, which is 53%, more likely to have an attack than adults, 45%. Unfortunately, there is no cure for asthma and is not curable. There is a peak flow meter, which works by measuring how fast your air comes out of the lungs when you exhale after inhaling. These measures is called a peak expiratory flow. It helps to see if your symptoms worsen. So, in conclusion, today we learned asthma is a respiratory disease that can be easily triggered for those who has it, but also can be easily treated for the ones who has it bad.